How does kidney failure affect your body? You've often heard about kidney failure, but do you know how it impacts your body? It's not just about dialysis. When your kidneys can't filter waste or prevent fluid buildup, every part of you feels the strain. From blood pressure issues to skeletal problems and even disruption of sleep patterns, kidney failure affects it all. Let's dive deeper into understanding these effects because knowing more could make a difference in your life. You might be wondering about who I am and why I'm qualified to talk about this. If you're someone living with chronic kidney disease, I've got great news for you. Hello, I'm Mathea Ford, a registered dietitian nutritionist specializing in chronic kidney disease and the owner of renaldiethq.com. I specialize in helping people just like you improve their health by making simple yet delicious changes to your meals. Together, we can transform your eating habits, boost your overall well-being, and ensure that you're enjoying every bite along the way. Say goodbye to bland and boring meals and say hello to a healthier, more vibrant life. Let's get started on this incredible journey to better health together. Visit renaldiethq.com today and take the first step towards a healthier lifestyle. You might not fully appreciate the tremendous job your kidneys perform every day. They're not only responsible for filtering waste products, toxins, and excess substances from your bloodstream, but they also maintain a delicate balance of electrolytes in your body. However, when there is a loss of kidney function, it's crucial to adjust your diet, as certain foods can further burden these vital organs or exacerbate health problems. Hence the importance of understanding dietary restrictions for optimal kidney health. In the context of kidney failure, the role of the kidneys in waste filtration becomes crucially compromised. Healthy kidneys serve as the body's filtration system, removing waste, extra fluids, and toxins from the bloodstream, which you may not realize your body even considers medications to be toxins. So your kidney does work to deactivate some of the medications you take, like insulin. In kidney failure, the kidney's ability to effectively filter and excrete these substances diminishes, leading to a buildup of this waste in the blood. This accumulation of waste products contributes to various complications, such as elevated blood pressure, a buildup of fluid or edema, electrolyte imbalances, and the deterioration of overall health. Dialysis, a medical intervention, is often necessary to replicate the kidney's filtration function in individuals with kidney failure. Through hemodialysis or peritoneal dialysis, waste products and excess fluids are mechanically removed from the bloodstream, helping manage waste filtration in the absence of your functional kidneys. The profound impact of kidney failure on waste filtration underscores the critical importance of early detection, timely intervention, and ongoing medical management to alleviate the burden placed on the body by impaired kidney function. Kidney failure patients must adhere to dietary restrictions due to the kidney's compromised ability to filter out waste effectively. In this condition, kidneys struggle to eliminate waste products, toxins, and excess fluids from the bloodstream. Dietary restrictions help mitigate the strain on the body brought about by kidney damage by reducing the accumulation of waste and harmful substances. For instance, a low-protein diet lessens the production of waste that the kidneys need to process. Likewise, restricting sodium prevents fluid retention and hypertension. Potassium and phosphorus restrictions are crucial to avoid electrolyte imbalances that can arise from impaired kidney function. By adhering to this special diet, kidney failure patients can optimize their overall health and minimize the risk of complications like fluid overload, electrolyte imbalances, and heart disease. Collaborating with your healthcare team or registered dietitian ensures that dietary restrictions are tailored to individual needs, promoting a better quality of life and potentially slowing the progression of kidney disease. You might already know that your kidneys are crucial for filtering waste from your blood, but did you also know they're key players in hormone production? That's right, these small yet mighty organs produce a variety of hormones that play vital roles in maintaining body functions. In our discussion, we'll dive into the specifics of these hormones and explore how they impact everything from blood pressure regulation to red blood cell production. Kidney failure has a big impact on the hormones your body produces, especially those that come directly from the kidneys themselves. This can lead to a hormonal imbalance, which is where renal endocrinology comes into play. Erythropoietin. This hormone prompts erythropoiesis stimulation or red blood cell production. Kidney failure reduces its production, leading to anemia. Renin, which regulates blood pressure and electrolyte balance. And when the kidneys fail, this control is faltering. Calcitriol, the active form of vitamin D necessary for calcium absorption. Impaired kidneys can't convert vitamin D into calcitriol, resulting in bone disorders. In severe cases, hormone therapy may be required to manage symptoms and restore this balance. The impaired production of renal hormones, including erythropoietin, renin, and calcitriol, due to kidney dysfunction significantly impacts bodily functions. Erythropoietin, responsible for red blood cell production, becomes deficient, leading to anemia, which then leads to fatigue. Renin regulates blood pressure and it becomes imbalanced, contributing to high blood pressure and fluid retention. And calcitriol, the active form of vitamin D, plays a role in calcium absorption and bone health. Its reduced production can result in bone weakening and disturbances in calcium and phosphorus levels, affecting skeletal integrity and potentially leading to disorders like osteoporosis. This leads to a condition usually called CKD-MBD, which is chronic kidney disease mineral bone disorder. The interconnectedness of these hormones emphasize how kidney dysfunction not only impairs waste filtration, but also disrupts a range of essential physiological processes, necessitating careful medical management to address these multifaceted consequences. Your kidneys play a vital role in fluid regulation, significantly impacting your hydration status, blood volume, blood pressure, and ultimately your overall health. If they don't function properly, you could face serious health issues. So let's dig into understanding how these two critical roles of the kidneys contribute to maintaining our body's delicate balance. The kidney plays a crucial role in maintaining fluid balance by excreting excess water from the body and preventing water retention. It achieves this through intricate filtration and reabsorption mechanisms. Blood enters the kidney where it undergoes filtration, removing waste products and extra water, forming urine. The reabsorption process then takes place, allowing essential substances like nutrients and electrolytes to be reclaimed and returned to the bloodstream, while excess water is directed to the bladder for eventual elimination. Hormones like antidiuretic hormone, ADH, regulate this process, adjusting water reabsorption based on your hydration level. In the case of kidney dysfunction, this balance is disrupted, leading to fluid retention, swelling, and potential complications. The kidneys play a crucial role in regulating blood pressure through a complex system involving hormones, fluid balance, and blood vessel constriction. The renin-angiotensin-aldosterone system, also known as RAAS, is a key component. When blood pressure drops, the kidneys release renin, which triggers a chain reaction leading to the production of angiotensin II. Angiotensin II narrows blood vessels and stimulates the release of aldosterone, which promotes sodium retention, salt retention, leading to water retention and increased blood volume. This mechanism raises your blood pressure. The kidneys filter the excess sodium, regulating its level in the blood. Through these processes, the kidneys influence blood volume, sodium balance, and blood vessel constriction, all of which impact blood pressure regulation. Dysfunction in these mechanisms can contribute to hypertension and other cardiovascular issues seen in renal patients. Kidney failure has a profound impact on both your blood and cardiovascular systems. Let's talk about how kidney failure can lead to anemia, a condition that arises when your body doesn't produce enough red blood cells. We're also going to explore the heightened cardiovascular risk associated with end-stage renal disease, ESRD, also known as end-stage kidney disease, and advanced stage or kidney disease where dialysis or kidney transplant becomes essential for survival. When kidney failure occurs, it often leads to anemia because the kidneys aren't producing enough of the hormone that helps create red blood cells. Anemia management becomes crucial in such situations. Production. Erythropoiesis stimulating agents, ESAs, may also be introduced, acting as a substitute for the hormone your kidneys should produce. In severe cases, you might need blood transfusions to maintain adequate red blood cell levels. The impact of hemodialysis on anemia is significant too. While it's essential for removing waste from your bloodstream when your kidneys can't perform this task, hemodialysis may exacerbate anemia by causing extra loss of red blood cells during treatment. I have another video about anemia and CKD that I will link to in the description below. ESRD patients face heightened cardiovascular risks due to intricate connections between kidney function and heart health. The impaired kidneys in ESRD contribute to fluid retention, elevated blood pressure, and electrolyte imbalances, as we've been talking about. As a result, the heart works harder, leading to left ventricular hypertrophy, which is enlargement of the left side of your heart failure, heart attack, arrhythmias, and other types of heart disease. The loss of renal hormones like erythropoietin affects red blood cell production, causing anemia, which strains the heart further. Additionally, ESRD disrupts the balance of calcium and phosphorus, affecting blood vessel health and increasing the risk of vascular calcifications. Inflammatory processes, oxidative stress, and vascular inflammation further exacerbate cardiovascular risk. Consequently, a comprehensive approach to managing ESRD should encompass both renal and cardiovascular or heart considerations to mitigate the substantial cardiovascular challenges this patient population faces. If you're living with kidney failure, you might have experienced an annoying and persistent itch. This itching, medically known as uremic pruritus, is a common symptom indicating your body's struggle to filter waste products due to kidney function reduction. We'll talk about the causes behind this discomfort and arm you with knowledge on how to manage and treat these symptoms effectively. Patients with stage 5 kidney disease commonly experience skin issues, including uremic pruritus and xerosis cutis, due to the intricate interplay between kidney function and skin health. Uremic pruritus, characterized by intense itching, arises from accumulated toxins that the kidneys fail to filter properly. These toxins irritate nerve endings in the skin, triggering itching. Dry skin is prevalent due to decreased oil and sweat gland function, coupled with dehydration common in ESRD. Scratching caused by uremic pruritus can further exacerbate dry skin. Both conditions impact patients' quality of life, causing discomfort and potential sleep disturbances. Proper hydration, maintaining your skin moisture, and addressing underlying causes like having effective dialysis and managing kidney function can help alleviate these skin issues. Collaborative care between nephrologist, your kidney doctor, and dermatologist, your skin doctor, is crucial for managing ESRD-related skin complications effectively. Treatment options for dry skin and uremic pruritus in people with end-stage kidney failure involve a multifaceted approach. For the dry skin, regular use of moisturizers alleviate dryness and itching. Avoiding hot water during bathing and using mild non-drying soap is recommended. Uremic pruritus can be managed through improved dialysis, reducing phosphorus levels, and addressing the underlying causes of itching. Topical treatments like emollients and creams with menthol or pramoxine can provide relief. Antihistamines and certain medications like gabapentin can also help manage itching. Collaborating with nephrologists, dermatologists, and other healthcare professionals ensures a tailored treatment plan to alleviate the discomfort and enhance the quality of life for people with kidney disease dealing with these skin issues. One major issue renal patients may encounter is bone mineral imbalance, a side effect that can lead to serious complications if not properly managed. We'll explore what this means for you, why it occurs, how it impacts your skeletal system, and strategies to maintain optimal bone health despite these challenges. Bone mineral disorders are common in chronic kidney disease patients due to intricate disruptions in mineral metabolism. In normal kidney function, the kidneys regulate calcium and phosphorus levels, maintaining bone health. In ESRD, the kidney's diminished ability to excrete phosphorus leads to its accumulation in the blood, triggering a decrease in calcium levels. The body compensates by producing parathyroid hormone, which is PTH, which pulls calcium from the bones to maintain blood levels. Elevated PTH levels cause bone resorption, weakening bones, and leading to medical conditions like renal osteodystrophy. The imbalances disrupt the delicate equilibrium between bone formation and resorption, resulting in bone demineralization, fragility, and increased risk of fractures in a person with stage 5 CKD. The intricate interplay of mineral metabolism, PTH, and bone health underscores the complexity of bone mineral disorders in this population. ESRD patients can take preventive measures to maintain good bone health and reduce the risk of bone mineral disorders. Adequate management of calcium and phosphorus levels is crucial, often through dietary adjustments and medications to control hyperphosphatemia. Monitoring and managing parathyroid hormone levels helps prevent excessive bone resorption. Regular exercise, including weight-bearing activities, supports bone density and strength. Managing vitamin D deficiency aids in calcium absorption and bone health. Adherence to prescribed dialysis and proper management of ESRD overall play vital roles. Collaborating with healthcare professionals for tailored guidance on nutrition, medications, and lifestyle adjustments such as regular physical activity is essential to optimize bone health and prevent bone mineral disorders, ultimately enhancing the quality of life for people with kidney failure. You're likely aware that kidney failure can disrupt more than just the body's filtering system. It can also wreak havoc on your sleep patterns. The interplay between chronic kidney disease and sleep disturbances is a complex issue, resulting in a variety of problems, including insomnia, restless leg syndrome, and sleep apnea. Understanding these issues not only helps to improve the quality of life for people with kidney disease, but also guides healthcare professionals in developing effective treatment strategies for such sleep-related complications. It's common for patients with kidney failure to experience sleep disturbances due to a variety of factors. You might notice insomnia prevalence, restless legs, or dream disturbances, making it hard for you to maintain good sleep hygiene. Consider these might be the reasons. Dysregulation of circadian rhythm, kidney failure disrupts the body's internal clock, restless leg syndrome. This uncomfortable sensation results in an irresistible urge to move the legs during sleep, and medication side effects. Sleep medications could inadvertently cause disruptions. There are several treatments available for sleep issues, ranging from lifestyle changes to medication adjustments. You might consider improving your sleep hygiene habits or exploring cognitive therapy options. For more severe cases, melatonin supplementation or specific sleep medications could be beneficial. If you're dealing with restless leg syndrome, there are various strategies that can provide relief. Remember, all treatments given for each kidney patient are individualized. Hence, if you suffer from any sleep disturbance associated with your chronic kidney disease, it's crucial to seek a consultation with your healthcare provider. Aside from the various systemic effects of kidney failure that we discussed, this condition has further notable effects in terms of mental health and digestive health. With a detailed understanding of these aspects, you'll gain a comprehensive view of the far-reaching consequences that renal failure could have on your overall health. Kidney failure's impact on mental health can't be underestimated, often leading to depression and anxiety. You'll find that the emotional stress you face can sometimes be monumental. Let's look at these three main effects: depression, prevalence, anxiety disorders, and cognitive decline. Look at the description below for a link to the article that talks more about this. In addition to these issues is the problem of social isolation due to physical limitations and dependency on others for survival needs. Remember, it's crucial to address these struggles immediately, as they significantly affect your quality of life and your overall health and outcome. ESRD patients often experience digestive issues, with uremic gastropathy being a significant concern. Uremic gastropathy, resulting from the accumulation of urea and other waste products in the blood, affects the stomach's function. It leads to delayed gastric emptying, reduced acid production, and impaired motility, causing symptoms like nausea, vomiting, and early satiety. Additionally, constipation is common due to factors such as fluid restrictions, dietary changes, and medications. These digestive issues contribute to poor appetite, malnutrition, and a reduced quality of life for ESRD patients. Adequate fluid management, dietary adjustments, and medications to control symptoms play pivotal roles in alleviating these concerns. Collaborative care involving nephrologists, dietitians, and other specialists ensures a comprehensive approach to managing digestive problems and improving overall well-being in ESRD patients. You see, your kidneys are crucial for keeping your body in balance, from waste removal to hormone production. Kidney failure disrupts this balance, affecting everything from your blood to your skin to your bones. It even throws off your circadian rhythm. Make sure you take the right steps to improving your kidney health to alleviate some of these symptoms. So remember, looking after your kidney health is essential for overall wellness. Don't underestimate the far-reaching effects of kidney failure on your body.